Okay, sir. Hello and welcome you all to this webinar on role of yoga in the prevention of epidemics, including COVID-19 and health promotion. It's an honor that we have Dr. Chandrakant S. Pandav with us, who is the president of Indian Coalition for Control of Iodine Deficiency Disorders, India, and former professor and head of Center for Community Medicine, AIMS, Delhi. I heartily welcome you, sir. Sir.
थैंक यू शुक्रिया बहुत बहुत आनंद है मैं आज आपकी संस्था में कई दिनों के बाद शब्द देने के लिए बहुत आनंद है बहुत बहुत शुक्रिया
सर हमारा सौभाग्य है ये, आपका बहुत स्वागत है सर। इसके साथ हमारे साथ संस्थान के निदेशक महोदय भी मौजूद हैं, आपका हार्दिक स्वागत करती हूँ मैं सर। इसके अलावा संस्थान के संचार एवं प्रलेखन अधिकारी मोहम्मद तैयब आलम जी तथा अन्य कर्मचारी एवं अधिकारी गण भी हमारे साथ मौजूद हैं। उन सभी का भी मैं स्वागत करती हूँ। आप सभी का हार्दिक स्वागत एवं अभिनंदन है। संस्थान की परंपरा के अनुसार प्रार्थना से कार्यक्रम की शुरुआत करने के लिए मैं श्रीमती सीमा सागर जी को आमंत्रित करती हूँ। सीमा जी,
आप सभी को मेरा प्रणाम। प्रार्थना के लिए कृपया सीधे बैठें, आंखें कोमलता से बंद करें, गहरा श्वास लें, पैरों का तत्पश्चात प्रार्थना। पूर्णमिदं पूर्णात् पूर्णमुदच्यते पूर्णस्य पूर्णमादाय पूर्णमेवावशिष्यते। ॐ शान्तिः शान्तिः शान्तिः। धन्यवाद।
संस्थान के संचार एवं प्रलेखन अधिकारी मोहम्मद तैयब आलम जी से अनुरोध करूंगी कि कृपया स्वागत वक्तव्य दें।
Thank you, Dr. Vandana. Good evening to all. The institutes conduct talk and orientation lecture by inviting eminent professionals and the individual on a regular basis. The same series, the institute has been conducting yoga for immunity lectures and sessions on Ahar, Vihar, and Nidra as part of Ayush for Immunity campaign, Government of India, Ministry of Ayush. In today's session, we have an excellent opportunity to know many things about the role of yoga in the prevention of epidemic, including COVID-19 and health promotion. Today we have with us respected Dr. Chandrakant S. Pandav, sir, former professor and head department for Center for Community Medicine, All India Institute of Medical Science, New Delhi. Pandav sir is also the president of Indian Coalition for Control of Iodine Deficiency Disorder since 2014. The institute is honored for accepting the invitation, sir, on behalf of Murarji Desai Institute of Yoga and my own behalf. It's my privilege to welcome you, sir. I extend my warm welcome to Dr. I.D. Basavareddy, sir, Director of Murarji Desai Institute of Yoga, for devising such a unique program for Yoga for Immunity campaign. In fact, Director sir is continuously involved in formulating such innovative ideas so that maximum people get benefited of such programs. I also welcome Dr. Vandana, Dr. Seema Sagar, and all the staff of the institute and friends who are associated with us through social media platforms. Thank you Thank you all. Go on.
Now I would like to invite Dr. Ivy Bhaskar Reddy, Director Murari Desai National Institute of Yoga, for introductory remarks. Sir.
Om Shanti Shanti Shanti. Professor Pandav, Sri Tayubji, Dr. Vandana, Seema, and my faculty members and viewers from various social media platforms across the country and abroad. I welcome you all for this weekly webinar program, and it's my privilege to say a few words about the achievement of our one of the most guiding force and institute a parental figure, Professor Pandavji, and also introduce the today's lecture. As you all know, Professor Pandav, Chandrakant Pandavji. So we have a long association of more than a decade with Professor Pandav. And he was former professor and head of the department of and very important Center for Community Medicine at All India Institute of Medical Sciences, AIMS, New Delhi. And now presently he is the member of National Council on Indian Nutrition Challenges under Poshan Abhiyan, which is chaired by none other than Vice Chairman of Niti Aayog. He is the founder member and the regional coordinator of Iodine Global Network, South Asia since 1986. Dr. Pandav is the founder member, vice president, and currently the president of Indian Coalition for Control of Iodine Deficiency Disorders, India since 2000. Starting from 1997 to now, he is the president since 2014. Most importantly, Dr. Pandav has been consulted on iodine deficiency disorders, IDD, since 1983 to over 60 countries to WHO, UNICEF, South Asia, Western Pacific, Middle East and African countries at national, regional and global level. To make a difference in someone's life, you do not have to be brilliant, rich, beautiful or perfect. You just have to care and be compassionate. What Dr. Pandav sir would like to say always. It's the most important thing. You just have to care and be compassionate. What a great message. It has come from it can only come from a person, a learned scholar. He is living his words. Dr. Pandav has been working in the areas of iodine deficiency disorders, micronutrients, health systems research, health economics, health policy, health program evaluation, public-private partnership, and human rights issues. More recently, he is trying to understand the linkage between science, society, and spirituality. As you all know that the Institute was conducting a very popular National Yoga Week, and he was one of the prominent speakers and used to attract a huge crowd of students and faculty by his innovative ideas. So recently, after his retirement, he is not tired. He is becoming more young, and we meet in very eminent gurus' spiritual concerts. Recently, we met at Hyderabad. He received the award by the hands of Reverend Daji, and like this, our association goes. And that's why today, Minister of Ayush has started a campaign a month ago Ayush for immunity. As part of this week, we have chosen Vihara for immunity. Under the Vihara, yoga practice itself is a Vihara. It gives relaxation, it gives recreation, it gives everything. And I found none other than Professor Pandav, who knows the modern medicine because he's a community medicine professor and very much the practitioner and appreciator of Indian systems and particularly yoga. And with long association, just a day for yesterday night after 10:30, I called him and he said just one आदेश दीजिए मैं आ जाऊंगा. So this is the association and affection of Professor Pandav towards yoga and our institute. And today world is under the pandemic condition, a lot of fear and stress on these things, and we have to open our mind, relax our body, and have fight. And it is fight, the strength comes within. So none of us are talking about the strength within strength of a human being. So that's why we are arranging these webinars, not going on very scientific presentations, clinical trials, and etc. So, but we are how to rise up within. So that is the only one system what yoga is to. That's why today Professor Pandav sir will talk about the role of yoga in the Ayush in general, yoga in particular, and in the pandemic conditions, particularly COVID-19, and also he will touch upon the health promotional aspects of yoga, which is very vital importance in this space. I will not, I don't want to take much time, and I just with these few introductory remarks, it's my privilege to welcome Sir Professor Panda Sir. Welcome you all, and on behalf of my institute and all the behalf of all the viewers, it's my privilege to welcome you, sir. I request you to deliver your orientation talk on the role of yoga in a pandemic condition, particularly in COVID-19. Professor Panda.
धन्यवाद. इस संवाद के लिए मैं आप सबको धन्यवाद देना चाहता हूँ. इस संवाद के लिए मैं आप सबको धन्यवाद देना चाहता हूँ. जो संस्था में मैं इस वक्त बैठा हूँ वो एक बहुत बड़ी महान संस्था है. We are very privileged. I'm very privileged and blessed to spend this evening in this institution. It was founded on 1st January 1976, and the first director was Acharya Dhirendra Brahmachari. And the second permanent director I learned was Dr. Basavareddy. June is a very interesting month from the point of yoga. 21st June, as you know, became an International Day of Yoga because of inspiring and tireless efforts of our Prime Minister, Sri Narendra Modi. But I'd like to share two more secrets about June. As I was waiting to talk in Dr. Reddy's room, I asked him what is his date of birth. He said, "Are you an astrologer?" I said, "No, I'm an astrologer of people who have made themselves by themselves." So his date of birth is 19 June. I won't talk to you about the year. And when did he join the institute? He joined in 24 June. It's a very interesting coincidence. 19 June, 21st June, 24 June. It's not accidental. There is a divine intervention in this particular aspect. I would like to recite Om for a minute. Om. My understanding of Om, if somebody were to ask what is the life's executive summary, in one word I said it's Om. The one who understands what Om stands for, and most important, what he means for, and equally important when he practices the meaning of Om, I think he has learned to realize who he is. he has come to know who he is. Now, there is also research, a lot of research going on in Western countries about Om is equal to E is equal to MC square. The institutions, especially in Western European countries, are heavily engaged in this research on Om is equal to E equal to MC square. I have a lot of stories to tell you about Om. I will tell you that some other day. Today the focus is on role of yoga, especially in any pandemic situation. And we're going through Corona. What is the precise role of yoga in Corona? And what should we do about health promotion? I must share with you that I've been very blessed and privileged to study at the All India Institute of Medical Sciences, New Delhi. The yoga's research was started in 1956, the year the institute was established. We had Dr. Baldev Singh, Dr. G.S. Chinna, Dr. B.K. Anand. They had carried out the first studies on yogic science way back in 1956. So there has been a historic and intrinsic link between yogic discipline and modern medicine. They use modern medicine methods of administration to understand what the yogic practice can do in terms of the respiratory rate, in terms of heart rate, in terms of maintaining temperature, and its role on positive health that can happen as a result of yoga practice regularly. इसके पहले मैं आपको कहूँगा नमस्ते, नमस्कार, नमस्कारम। जब आप हंसते गाते और कभी कभी रोते हैं तो हम आपको नमस्ते कहते हैं। जापान में there is one day in Japan where there is a public come together and they cry. Rudali, famous film by Kalpana Rajvi and Bhupendra Hazarika, they have a film called Rudali. तो एक बड़ा संदेश है, आप हंसते गाते रहिए, लेकिन रोना भी आप उससे मत डरिए। चाहे कोरोना हो तो रोना जरूरी है। तो आप हंसते गाते हैं तो हम आपको नमस्ते कहते हैं। जब आप आजकल पॉपुलर जो कार है उस कार से उतरते हैं तो हम आपको नमस्कार कहते हैं। और अब शाम का समय है, बसवरेडी के साथ में शाम का भोजन लूँगा, तो मुझे जब रसम खिलाएंगे तो मैं उनको नमस्कारम करूँगा। नमस्ते, नमस्कार, नमस्कारम। कोरोना कोरोना ये क्या किया तूने चमत्कार, कोरोना कोरोना ये क्या किया तूने चमत्कार। आजकल सारी दुनिया करती है एक दूसरे को नमस्कार, नमस्कार, नमस्कार। नमस्कार देखा जाए तो हमारे आचार्य हमारे काम में दोबारा आ गए। नहीं तो हम क्या कहते हैं, हेलो, वी टू शेक हैंड्स, नाउ वी आर डूइंग नमस्कारम। Namaskar comes as a part of Anjali Mudra. You put your hands in front, stretch your fingers, bring them very close to the chest, bow down with a smile. And when you say Namaskar, actually you are connecting to the Atma in your person whom you are doing Namaskar. That is the deep philosophical meaning of this simple practice, which because of Corona, we have begun to use it. Namaskar. I am currently focusing a lot of attention on ancient wisdom and what is the relevance of modern science. This is the first example. A simple gesture of Namaskar, we have written to come back, and it's such a deep philosophical meaning that in a sense you are connecting with the same Atma, and we are the same disciples, same parts of the Paramatma, so that we are all connected and we are equal. So that's the second message I want to give it to you. The deep meaning behind Namaskar and the Anjali Mudra, which you had forgotten. Remember, the most important part of this is you bring the fingers very close to the chest, bow down, namrata, and smile. Every gesture, every aspect is very important, and then you say Namaskar. So that's the second point I wanted to share with you. Third point is about Corona, role of yoga in Corona or any other pandemic. Basically, it's very simple. It's all about resilience. It's all about resilience. It's about being ever prepared to fight any pandemic, any disease for that matter, be it communicable disease, be it lifestyle-related disease. The story is about resilience. When it comes to corona, there are two components. There is an external resilience and there is an internal resilience. The internal resilience, Honorable Prime Minister said the other day, there were three important things. Mask, wear the mask. In fact, persona means mask. So this is a new persona we got. So the new national norm today is wear a mask. That's very much. If you ask me what is the message, I will say, don't ask me, wear a mask. Make it your regular task. When you wear a mask, it's important that you wear it, cover the nose and the mouth. That's very critical. Why nose and mouth? Because the point of entrance, what I call of this grand queen coronavirus, is through the nose and through the mouth. So basically, you are protecting yourself, you are protecting others by wearing the mask. The mask is for self-protection and protection of others. When you wear a mask properly, it gives you 60% of the protection against corona or any other disease related to respiratory virus. The second important point our Honorable Prime Minister said is very simple. Hand washing. And I would add to that washroom hygiene. आप जब भी किसी को टच करते हैं आप अच्छी तरह से wash your hands. I've been involved in hand washing movements since very long. In fact, the World Hand Washing Day was recently over. It's celebrated on the 10th of October. And you'll be surprised that Sachin Tendulkar is the brand ambassador of hand washing, which uses Lifebuoy soap. Now, hand washing, you know the exact style in which it is done, very critical. And actually, there are references in the Vedas and scriptures about how to wash your hands. That is a reference I have got in my paper, which I'm going to leave with Dr. Reddy, so that it can be widely circulated. In fact, I'll go a step further. Our ancient scriptures also mention that after the act, how do you do ablution? Very detailed description. So it's just fascinating. It's just fascinating what we consider today as modern science, modern practice, has been our ancient culture, ancient heritage for years to come. And I think this corona period has given me a chance and opportunity to link the ancient wisdom with modern medicine. I belong to the school of not either or, but I belong to the school of and. These are artificial divisions. We forget the main point. These are artificial divisions. Ayurveda, modern medicine, yoga, these are all homeopathy, allopathy. These are all artificial divisions created by man's thinking. Basically, when you want to remain healthy or when you want to protect yourself from any illness, what is the primary concern of a patient? To have relief from pain and suffering and to get well. So the main point we have forgotten about over a period of time. It's painful for me to say that we are spending a lot of time and energy in deciding which is the better system of medicine. To my mind, there's only one system of medicine, that gives relief to the pain and suffering and the disease the person has. But we have created these what I call as different castes of medicine. And we're in India, we are cursed by the caste system. To me, this is a new caste system of allopathy, homeopathy, Ayurveda, yoga, Unani, Siddha. I think we must overcome together this new caste system that is in the field of medicine. It's all complementary. It's all additive. I would not use the word even supplementary or alternative. There is no alternative. There is only one medicine which brings relief from pain and suffering. So that's another important point I want to make. What we lack, especially my colleagues in the modern system of medicine, where they get their MBBS, MD degrees, empathy and compassion. When you interact with them, Today's physician, evidence has shown, spends less than 2 minutes in terms of talking to patient. Less than 2 minutes. Historically, when we had the Ayurveda system of practice, what the patient is to do, when the doctor is asked, "Kya aapko kya takleef hai?" what the patient used to do is offer his hand and say that when aap nadi pariksha kar dijiye. We have forgotten the art of nadi pariksha. In fact, when the doctor, when the Vaid is doing nadi pariksha, in essence is asking a detailed history. So history, taking history has become history. And 90% of your diagnosis depends on how well you take the history. 90%. 5% on your clinical examination, 3% on the laboratory test, and 2% on high degrees of laboratory score, CT scan, MRI. But what has happened in the real life? Doctor doesn't have time to take the patient. Recently, I wrote an article in a magazine called Horizon, published by the Tata Trust. The main message of that article was my colleagues who are practitioners of medicine should learn the art, should learn of listening. So, Dr. Reddy, I would like to leave my second paper that doctors must learn the art of listening. So that's my next message. Then we're talking about external resilience and internal resilience. The third external resilience is physical distancing. I must say with deep anger and anguish that the word social distancing is used. To me, this is the most asocial, antisocial, hard, derogatory, insensitive word. But about physical distance, keep 1 meter away. Social distancing in the Indian context has a very serious meaning. Social distancing in Indian context means you are untouchable. So I must request you, Honorable Prime Minister, to bring it to the notice of your scriptwriter who has written your speech that kindly change the meaning of social distancing to physical distancing. It's a very sensitive word. So मैं प्रधानमंत्री इस माध्यम से मैं आपको प्रार्थना करता हूँ कि आपके जिन्होंने स्क्रिप्ट लिखी है कि उन्होंने सोशल डिस्टेंसिंग को भगाओ, eradicate the word social distancing and please bring physical distancing. You are adding a new dimension of suffering to the patient who is having corona by introducing social distancing. You are bringing a new dimension of hatred, anguish on this particular aspect. आपसे प्रार्थना कर रहे हैं आदरणीय प्रधानमंत्री कि हम सिर्फ फिजिकल डिस्टेंसिंग का इस्तेमाल करें. These three components constitute the external resilience. Now let's come to the internal resilience. In which Ayush is an integral part. Besides that, there is mantra jap. There are studies which have said that the mantra jap done collectively, individually, has definite effect on the various health parameters. Sangeet. Sangeet is also very important as a mood elevator. Where medicines fail, music heals. And we are a rich tradition of music. So mantra jap, sangeet, dance. If you see in a culture, dance is an integral part of a culture. When a child is born, we dance. When we have festivals, we dance. When there is a wedding, we dance. And in some communities, when there is death, they celebrate the death and they dance. So dance is also a mood elevator. It helps you to release endorphins and break into that particular mood. So Sangeet, Mantra Jap, dance therapy. Next is what we call as sitting in the sunlight for about half an hour between 10 o'clock and 3 o'clock. Because vitamin D deficiency is made when your skin body is exposed to the sunlight. So this is another part of the internal resilience. Then, since we don't have enough vitamin D, the whole of India is vitamin, all over the world is vitamin deficient. So you take the medicines that give you that are rich in vitamin D. Next comes vitamin C, or natural substitute in terms of lemon, amla, and other vitamin C rich fruits. So vitamin C is also an important part in terms of healing and protection. Now coming back to Ayush. So I shared with you the importance of mantra jap, music, dance therapy, vitamin D and vitamin C, which build up your immunity. Finally, I come to Ayush, Ayurveda, Yoga, Unani, Siddha, and Homeopathy. Ayurveda is science of life, positive way of looking at life. What I studied at the All India Institute of Medical Sciences is science of disease. That's the main difference between Ayurveda and the medicine that I've learned at AIMS New Delhi. There are now various studies that are going all over the world which are using modern methods of research in terms of randomized controlled trials, meta-analysis, cohort studies, cross-sectional studies, which are using these modern methods of evidence to understand how Ayurveda is not only very efficacious, but effective and also efficient. That's a separate subject. Sir, when there is next time, I would like to cover this topic about modern methods of investigation, where a lot of excellent studies have been done on Ayurveda. Coming to you, the All India Institute of Medical Sciences has a laboratory in the Department of Physiology, which carries out studies people who are doing yoga sadhana. There's a spectrum of parameters in which the studies have been done. That's another opportunity I would like to share with the audience in more details. Dr. K.K. Deepak, Dr. Yadav, these are two faculty members at AIMS who are deeply involved in this particular study, carrying forward the rich heritage founded by Dr. Baldev Singh, Dr. G.S. Chinna, and Dr. B.K. Anand. So we are using modern methods of instruments to study the ancient practice of yoga. As I mentioned, one of the important aspects in yoga is when you do meditation. When you do meditation, what essentially is that you try to make your mind still. That's like making your water still. When you have your mind still, you're in a better position to take informed decisions. And my understanding, my guru, Shri M of Satsang Foundation, has told me repeatedly, meditation doesn't mean sitting in a dark room, closing your eyes and thinking about what's happening outside. Whatever work you do, whenever you give 100% attention to that activity, that is meditation. When a mother cooks food for your family, she gives 100% of attention to that cooking rajma. क्योंकि वो लोग कहते हैं तुम्हारे पास क्या है, तो मैं कहता हूँ मेरे पास राजमा है, दूसरा कहता है मेरे पास माँ है, लेकिन मैं I'm very fortunate, I have both, I have माँ as well as rajma. So the 100% attention is meditation. And actually the frequency of meditation, you can do it 24 hours. Our ancient system of medicine is so flexible, it's not prescriptive, it's user-friendly. So that's the importance of yoga. The other thing it does, the example I'll tell you a story. I don't know how much time I have. I'll tell you a story. When there's a story from Mahabharata. I'm very familiar with Mahabharata because I'm a Pandav. And प्रधानमंत्री ने कहा ये करोना का सामना एक महाभारत का युद्ध है. So when there was a scene of Arjuna trying to hit the right eye of the fish, Lord Sri Krishna said, Arjun, what you do is you put your arrow, put your bow in such a size, and this is how you hit it, and you have been very well taught by Dronacharya. You are his favorite Shishya. But what I will do is, when Arjun told Sri Krishna, you can do this much, then Arjun asked Lord Sri Krishna, incidentally Lord Sri Krishna is a yogi. We'll come to that later. तो अर्जुन ने श्री कृष्ण को पूछा कि अच्छी तरह से मछली के आँख के फिरती हुई मछली के आँख में देख रहा हूँ, लेकिन श्री कृष्ण ने कहा पार्थ तुम अभी तक समझे नहीं कि मैं कौन हूँ. जिस पानी के अंदर तुम मछली की छवि देख रहे हो, उस पानी को मैं स्टिल बना रहा हूँ, उस पानी को मैं मेडिटेट करने जा रहा हूँ. So that is the depth and the contribution of stillness that can cause. I briefly mentioned about yogi. Bhagavan Sri Krishna is the world's first yogi, and I consider Bhagavad Gita as Jivan Grantha. If you read Bhagavad Gita, you get a different interpretation and meaning of the same story. That is the beauty of it. So I don't want to slowly tell about Mahabharata and Yoga, but we'll do that some other time. So in essence, what I want to say is in current areas of pandemic corona or any disease for that matter,